All right. See here. It is at 12:02, so we will get started. Hello, Christina Abel. How are you, my friend? Welcome to today's training. I am Mike Sokolowski, Director of Grassroots Advocacy here at Hearts for Home Care. Welcome to everyone. Today is going to be content about leading a legislative meeting. We're going to go through the trajectory. We started a few weeks ago with the welcome, a little brief overview of what advocacy is all about and how you're going to get involved. We heard about public affairs and social media opportunities because that could happen at any time. Just to get you ready for that, this week we've progressed to face, you and a legislator, and how easy this is going to be. So before we do, we always have a trivia, and no different this week, except our trivia is going to happen slightly into today's actual training. It'll be a question that I give all of you. And again, as always, the first two to respond in the chat get the secret prize. Before we go, like a legislative meeting or anything else you do when it comes to advocacy, please, not only for the information so that we can advocate better for field staff and clients, but to recognize you, the advocate for doing it, please go to the Hearts for Home Care website and go to report your actions and tell us what you're doing. We want to reward and recognize you for all these great things, not just get the information back from the meetings. This is a little give and take. So always remember, only way we know what you're doing is if you report your actions. We have nothing else to go on. So leading a legislative meeting. When the opportunity arises, either in the Capitol for an advocacy day, in local district offices, meaning close to your house, there'll be a site where your legislators have at least one, a lot have multiple, or at the Capitol if you just happen to be there, not on an advocacy day. So the steps to getting started are, who is it that you're going to meet with? Who is the legislator that you're going to set up this meeting with? Well, here's our trivia. Legislators like to hear from only one group of people. Who is that group of people? What is the two-word description? Oh, wait, we got it. Mike Stacy and Stasha Frazier beat everyone to the punch. Constituents. I was saying two, direct constituent is it. So kudos to all those that got the answers in, but I can't cheat. It's right there in the chat, the first two names to come through. Kudos, Stasha and Mike. So yes, direct constituent legislator, direct constituents. It's not that a legislator wouldn't take a meeting with just anyone, and there are reasons and purposes for that, but the most impactful meetings are when a legislator meets with their direct constituents, because they know those are the people that are voting for or against them every 2, 4, or 6 years, depending on what type of role they have as an elected official. So to get started for that, if it's going to be not an advocacy day, because that is easy, either Hearts for Home Care, national associations such as HCAOA or the Alliance will plan these type of things. But when it comes to meeting in district or at the Capitol individually, what you're going to want to do is just reach out to us before you get started. Advocacy@heartsforhomecare.com. Great way to prepare for this. When you do, let us know what your plans are, where it is, and then we'll talk about which of your direct constituent legislators is most appropriate for the meeting. Meaning, if you're advocating on behalf of home health or hospice clients or patients, you're going to want to meet with your federal legislator. Medicare impacts things related to home health and hospice more. If you're in an office such as assisted care state programs, skilled nursing unit, you're going to want to work with state legislators, specifically that your direct constituent legislators, because that's Medicaid driven. So that's where when we talk about what the most important or specific legislator is, Medicaid and Medicare drive a lot of those decisions on what type of legislators it is you're going to meet with, because it impacts the reimbursement for those type of services. So next, we're going to figure out state, federal, who it is you're advocating for. We're going to reach out either email or phone call. Phone call, I like to think if you're new to this, is a great way to get started because it's your first step on getting comfortable speaking with the legislative office. And you're in your own office, room, house, wherever it may be, and start to feel yourself out on having a conversation with the legislative office. Never have stress. It's not stressful at all. Pennsylvania has a full-time legislature and a few other states, but federal legislators are the ones that really have that full-time role in a couple of unique states. The rest are something else as a profession. They're not legislators all the time. So they are not experts at everything. When you go there and talk about home care, home health, hospice, whatever it is, you are going to be the one that has the most information to provide them and guide them and make decisions later on when they get together as groups, caucuses to vote on bills, whatever it may be. So we're going to reach out either email or phone call. When you do reach out via phone, typically the next step is going to be to send an email in writing on some potential dates that work for you. Super easy. We'll get it scheduled. And they'll come back with whatever that appropriate time and date is. And then that's where we'll do some extra follow-up. So now you have the day, the time, where you're going to have your meeting. So now we get down to the nitty-gritty. What are you going to talk about? So how this goes step by step is we will talk about how long you have and what to bring, what to say, etc. After you reach back out to us after you've coordinated the specific legislator, you verify the time, and now you're going to have that meeting. And what are you going to do? So we'll sit down and we're going to go off of a state legislator as an example for this, for the first one. So say you're meeting with state legislator on nursing rate increases for pediatric clients. This will be our example today. So use me as the person that meets with you. We'll sit down or virtually meet and discuss, one, what kind of collaterals you're going to bring. In terms of the ask itself, if it's a rate increase, policy driven, whatever it is, we will provide you with fact sheets and leave behinds on the legislative side of things for your folder or your leave behind with the legislator having that meeting. Second, collaterals from your office in that same folder that you will bring to this meeting. Bring materials, a lot of materials that kind of go over the process of what happens in a skilled nursing office. That's what we use as today's example, kind of competencies, coverage areas, types of clients you care for, where you're looking to send other constituents that want to be hired in that field. But again, you want to leave professional leave behinds. And lastly, specific to home care. We all get that you're getting an opportunity to speak with, work with a legislator, sit down and meet. If you're doing it this way, through us helping, this meeting is about home care. So if there's a stop sign in your neighborhood that you don't like, or something locally that should be a one-way street, despite the opportunity to meet with the legislator in your district, please save that for a separate meeting. If you're advocating on behalf of home care and we go through this process, keeping on point during this meeting is key. We don't want to be disheveled or have multiple things going on. It looks more professional and comes across that way if you're having a meeting specific to the ask that we've all established. Second, so you have the collaterals. We'll go through the collateral conversation with you. When you get to the meeting itself, you're going to have the open. Let the legislator reiterate who you are, where you reside, because that's the key connection on the direct constituent, where you work, the coverage area where you provide services, the type of clients that are taken care for by your home care office, and getting to the point of why you're here today. So the why you're here today, we'll go through that fact sheet and the asks that you will have during that meeting to get the legislator to support what it is we're asking for. Few things here. We'll walk through that fact sheet with you. You'll have a folder for the legislator to provide them, but on your end, you'll have your own folder. This isn't something that we're going to have a meeting and you're going to go back and memorize every single thing that we talk about and memorize that fact sheet and not look at it. The meeting is too important and there's not enough opportunities to get face-to-face visits like this. So there's no stress to try to memorize all of this and miss something just because you didn't memorize it perfectly. Get the sheets of paper, have them in front of you. It's fine to keep looking up during the conversation, but it's also fine to have your head like it is now, down, looking at the sheet and getting it right. That way you're able to explain it clearly to the legislator and give the legislator the opportunity to ask questions. So during this part, here's a great tip. So if you go through all of this, you're looking at the sheets, you're providing what it is that you want to accomplish, and the legislator has a question for you specific to an ask. How much would this cost the state per resident? You know, something out of the purview of our pre-call material. The best answer to a question you don't know the answer to is, anyone in the chat want to put that? Anyone have a guess? If you don't know the answer to something from a legislator, I will find out. Very good, Taryn. The other one is, I don't know. I'll get back to you. There you go. Be honest. Tell them you follow up. These are all, Lamaine, I see it. Anisha, great answers. Melissa, love it. Great answers. Never guess. And definitely don't be adamant about something that you don't know the answer to either. Saying I don't know gives you the opportunity for something else. So I like that the chat has been very active. Let's do it again. So if you don't know the answer to a question, what does that give you the opportunity to do? How does that help you by not knowing the answer? Oh, Cindy. Good. Research, yes. And then the result of the research is, Caroline, I see them coming in now. Follow-up meeting, second meeting. Perfect. So just like that, by not knowing the answer, it's giving you the opportunity to build a stronger relationship and schedule another visit. I'm going to read it right off of Lamaine's answer. Thank you. So, what you do know the answers to, provide them. And then at the end of the actual lateral or fact sheet conversation in your meeting, the next thing you're going to go into is the one thing that you do have down. You don't need a sheet or a collateral to help you with. It's the story. So now you've done the open, tell the legislator what it is that you're there for. You've gone through the facts and data supporting why you're asking for a specific thing. Typically, home care visits like this with the legislator, the asks are for rate increases, and they're for rate increases to hire more field staff and to staff more cases. So we can serve millions and millions of home care consumers and keep them where they want to be. So the story is what comes next to support those asks. You all have that down. Now, when I say this, I know and I recognize that not all of you work in home care support actual offices where the care is being provided. Some of you work in insurance offices for home care. You're advocates in a role that are chief X, Y, and Z of a home care company listening to this call. You're not taking care of clients every day, but you know others that do, or you know struggles on the insurance end of what consumers go through to get coverage for home care. So it's not just stories of taking care of an individual, but there's also stories behind the scenes from the other avenues of home care in which you work. Now comes the fun part. You've gone through the story, you've made the story personal, you make the legislator have that connection, you tug on the heartstrings with whatever the story is that you're going to go through, and that is your story. That's your personal story. Now you get to the fun part of the ask. Going through all the steps that we've gone through and not pulling this part off would result in a wasted move. And why I say that is if we're going to get any traction with legislators on our asks going forward, I deem this as the most awkward part of the meeting itself. But they get asked the same question over and over again every day that they have a meeting with the direct constituent. So don't worry about it. But what you have to do is, legislator, do you support what it is we're asking for? Example, a $5 an hour increase for skilled nursing reimbursement rates this year. The answer is yes. Super. Kudos on the follow-up with us. Let us know. We'll utilize that information with all the coalitions or groups we're working with to try to accomplish that increase. The answer is maybe or no. Don't fret. Probably going to happen more than the yes. If it does, just like not knowing the answer to a question a legislator has, this gives you the opportunity for meeting number 2. If the answer is no or maybe, you say, what will it take to get you to a yes? When the legislator says, I need more data on reimbursement, or I need more data on this, you're able to go back, reach out to whoever it is that you met with from the Hearts for Home Care team, let them know that this is the facts, figures that the legislator needs to get to a yes, and the answers need to be this. We will then follow up, provide you with whatever it is the ask is, for you to either reach out. I mean, it could be a quick email. It might not be something so thorough that you have to have another meeting, but gives you the opportunity to reach back out and say you have the answers and I'd love to follow up again. When you follow up with that, it's also important to do the reiterating question. Now, do you support our ask? Because we eventually, the goal is to get to the yes. And if you think about it, even though we work with different coalitions and partners and state and federal advocacy at Hearts for Home Care, there's so many people that work for these associations, Hearts for Home Care, whoever it may be that we build a coalition with. So look at it as like a spider effect going throughout the states or federal legislators. Having you meet in district with your legislator, you're able to have more touch points throughout the states or the federal map. When they come together and meet, you have more people with knowledge on why saying yes to a new skilled nursing rate increase, we're going to stick with that example, of $5 benefits the state that you're in. So that is a big part of why these district office meetings spidered out throughout the state with your direct constituent legislators as a member of Hearts for Home Care are so important. Now, don't leave yet. While you're there, one of the ways you advocate from the desk, this gives you an opportunity to get a picture with the legislator before you leave. Selfie if there's no one else in the office besides you and the legislator. Typically, there's a legislative assistant there at least. Take a photo. Be sure to share it with the legislators themselves. I will say this, to the degree that I worked with a legislator whose nickname was Cheese, and it was not because of his love of dairy products. It was because he never missed an opportunity to take a photo, because they like publicizing their photos. So when you take this photo with the legislator, ask them if you want to send it to them, tag them on social media, email it, send it direct text, whatever it may be. And then you're going to connect with us in the follow-up meeting with that picture, and we'll share it through our social media sites. And then the people that work for Hearts for Home Care will tag the appropriate legislator, showing gratitude for the meeting, etc. It also gives you the opportunity to promote what you're doing in the community for whatever office it is that you're in. Share it to your page, to your professional office's page. Let everyone know in your community that you're advocating on behalf of home care clients and staff. Send it on your personal page. look what I do in my time advocating for others. So these are all, again, great opportunities to have impact over just that one meeting. Sharing on social media on different avenues, working with the legislator, providing them with the opportunity to share that same picture. Sometimes they will put it in the paper because this is what they do. They might put it in the newsletter that they share with all of their constituents when they provide updates. But again, this meeting is more important than you think, and they're typically 15 or 20 minutes. There's a lot that you would get out of it. So with this, I'm going to pause here briefly. And let's take some questions about setting up the meeting, key legislators, follow-up. How do you get started? What do you have? Anyone have any questions about this process itself? Again, be confident that you are more of an expert going into this than they are. Any questions? And coming up, we have, again, other opportunities. I'll get to that question in 1 second. We'll have other opportunities on the variety of options for you to meet with the legislator. So today it's just a general overview. Next week, we're going to hear about setting up legislative home visits, where you bring a legislator into the house of a direct constituent receiving care. But yes, and then we're going to have a roundtable, leading a roundtable where you invite legislators to your office, invite other staff in, maybe other offices that are like your specific office, have a few members come over to attend that. But I just want you to know this is the general meeting session, and we're going to talk about the specifics in upcoming trainings. So let's get to Cindy. How do you get past the person who answers the phone when you're called to set up, or is it better to walk in? So in setting up the meeting itself, just walking in is probably not helpful because you don't even know if the legislator will be there. So the best way to go about this is the phone call or the email, given that you have time, the runway set. We're doing this now about leading a legislative meeting so that you have time to absorb what you learned today or watch this recording. Obviously, not everyone watching this live, and set up that meeting over the next few weeks with your legislator. So that gives you a runway to get to it. And then at that time, when you get the concrete date and day down, it's easier to go into the meeting. You don't want to waste an hour of back and forth, stopping or popping into an office if there is a chance that they're not there. Karen Lawler, can you talk more about specifics or tricks to set up meetings? So no tricks, definitely no tricks. But I will say tip is when you do call for the meeting itself. If I am calling, so say we'll use my state legislators as an example. So if I am calling Kyle Mullins or Rosemary Brown, I am going to call, get the general person that answers legislative assistant. And the first thing I'm going to say, hi, I'm Mike Sokolowski. I am a direct constituent of Representative Mullins, Senator Brown, whoever it is that I'm calling. And I'd like to schedule a meeting on behalf of home care clients in their district. So two things. You're bringing in others, not just yourself as direct constituents that you're doing this on behalf of. But the primary thing is you're saying that you are a direct constituent. I don't know of any. I could ask my colleagues, but I don't know anyone that's called for an in-district meeting and they were told, no, I don't do that. So that doesn't happen. But in terms of the setup tricks, I guess it wouldn't be a trick, but definitely stick to what we talked about as key in the beginning of this, is letting those that you're speaking to know that you are a direct constituent. And that is really the trick I will give you, or the tip that'll get you past step one. So I have another question. As a newcomer, how do I initiate the process? So advocacy at heartsforhomecare.com is our general mailbox when you want to reach out to any of us on our team. And then we each have individual specialties. I work getting everyone prepared to do engagement on behalf of clients and staff. We have individuals that work in states that advocate and directly lobby for these increases. We have public affairs and social media persons. So what I would do is step one on this process is send an email. I meet one-on-one with advocates, multiple advocates each week, doing the same thing, preparing them for either their first meeting, advocating for the desk in terms of engagement through social media, action alerts, whatever it may be. But we do this all the time to prepare you and give you a better idea of how it goes. Do not be afraid to reach out to advocacy@heartsforhomecare.com and set up a one-on-one meeting with myself, or it might be one of my colleagues. But we will meet with you as soon as possible. We don't drop the ball on this, and we will get you to the right person so that you have a great experience advocating like this. We do. Oh, all right. So Cindy, before I get to Asa, you were told no room on the calendar. I guess a follow-up would be how far out is that calendar? So my follow-up to them is when you call back in February, March, April, reiterate that you are a direct constituent of the legislator and you would really like to take the opportunity to meet with your direct constituent legislator and let them know, not in a mean way, but that there must be an opening at some point during the legislative season and see how that goes. If that doesn't work, again, please reach out. Cindy, you definitely have my email, reach out to me and we can talk about that further. Asa, personally call and act with another person. I like that. I like that tip. Call as if you're friends. I appreciate that the team is always willing. Yes, Asa, we worked with last year. Asa set up not only legislative visits, but he had open houses and legislative roundtable home visits last year, executed them all beautifully. And one of the keys, Asa attended trainings, asked questions, met one-on-one with myself and other members of the team. And again, we are always here. Caroline Pierce, sometimes creating a relationship with their assistant aide is just as important as creating a relationship with the legislator. It's almost like Caroline was like a highly decorated advocate over the past year or something with that comment. So yes, Caroline is right. Legislative assistants and legislative aides all have specialties. So as I said in the beginning, not every legislator can be an expert on everything. Legislative aides on the state level will be less than the federal, but they will still have their own lanes that they're going to do background work for the legislator and investigate, the fact sheets that we bring to meetings, etc. So yes, forming relationships with them who are the closest to the legislator. If you are able to convince them, just as a legislator, about your asks and they fact check everything, and if they find out that you're saying, I don't know, when you should say, I don't know, and answering the questions only when you're confident, that will go a long way with them influencing the legislator to get you to a yes. So that is a great point, Caroline. Yes, making a relationship with their legislative assistants or aides are just as important. And I will say on the federal side, so we have federal work that we do here at Hearts for Home Care as well. When you go to a federal local office to meet with the legislator, you will notice they have many more staff in their local offices than a state legislator. If you meet in the Capitol, Washington, D.C., with a federal legislator, they have even more staff. And that is because now they really have experts in each and every field to do the research and the background on what it is you're presenting and asking. So again, be confident that you're the expert going in, but know that someone will double check your work. We will be confident in what we give you in terms of the leave behinds and the fact sheets. You just be confident on the stories that you're going to communicate and the answers that you're going to give. If you don't know, you're going to say, I don't know. Anyone else? Any other questions today? Well, with that, Stasha and Mike, kudos. I will get you your Parts for Home Care promotional material in the mail. And everyone else, 2 reminders, report your actions. I may have said that in the beginning, but yes, go to the Hearts for Home Care page. Anything you do, social media posts, meetings, advocacy days, whatever it is, action alerts, make sure you use the report your action button on the Hearts for Home Care page. Let us know. Second, next Wednesday, leading a successful home visit. That is a very good one, and that is the coup d'etat of all legislative visits. If you can get the legislator to come visit a home care client receiving care and see the competencies that go into it, home run every time. So with that, email advocacy@heartsforhomecare.com if you have any questions whatsoever from me or any member of the Hearts for Home Care team. Definitely get back to you as soon as possible. And Gail Hughes, the link for next Wednesday's call will go out via Hearts for Home Care. And also, if you're a Hearts for Home Care ambassador, you will get it through Outlook as well. All right. So thank you everyone for joining. Appreciate it. And as always, all the trainings and recordings are on Hearts for Home Care YouTube channel. Go check us out and subscribe for free. Everyone have a great day.